Hello, everybody. Thank you for joining us, and welcome to our webinar today titled Transforming School Communities Through WSC, Social and Emotional Learning and the Role of Health Educators in Schools. My name is Jordan Buckley, and I am the moderator of your webinar today. I am the Manager of School Health Programs at Sophe, the Society for Public Health Education. On behalf of Sophe, we are pleased with the interest in today's webinar and thankful that you have taken the time out of your day to participate in our webinar. Holly, I'm excited to hand it over to you.
Thanks so much, Jordan, and happy National Health Education Week. I am very excited to be here today. You know, I had mentioned to Jordan earlier that one of the benefits of the work that I do is getting to work with folks such as yourself. So thank you for taking the time to be on this webinar today and for taking the time to consider, when we talk about the whole school, whole community, whole child model, how we can work with concepts such as social and emotional learning and those competencies to really improve the health of each of the students that we interact with, whether it's at the K-12 setting and before and after school settings and or at the higher education setting. Because all of these settings have the opportunity to impact our students in really meaningful ways. So thanks for having me. Our objectives for this webinar include being able to define the social and emotional learning and core competencies involved with those. You will be able to describe the ways to implement the whole school, whole community, whole child model, specifically related to SEL core competencies and skills. And I would even add to that the skills of the National Health Education Standards. And then finally, be able to discuss how teacher education programs can prepare health educators to integrate SEL through the WSC model. One of the things that I hope to highlight throughout this webinar are the multiple opportunities that we have and the role that we as health educators can play as connectors, not only for our students, but for our families and for our community members. So diving right in, when we think about social emotional learning and being able to define it, the competencies most commonly used and that we're going to focus on today come from CASEL, the Collaborative for Academic, Social, and Emotional Learning. If you take a glance at this wheel, one of the things that may jump out to you are the connections between the competencies and the National Health Education Standards. There's quite a bit of overlap, and in a few moments, as we go through each of these areas of competency, we're going to talk about what that direct overlap might look like and some opportunities for you as health educators to integrate these into the work that you do. Another key feature to point out here with this model is that we're recognizing that social and emotional learning is not something that we do to children, right? That we may be using it and employing strategies in the classroom, and we also need to be a part of a role in how this plays out across the school setting and then translates to home and communities. Taking all that into consideration, let's just take a moment to look at the WSC model. Right? The 10 components, which health education is a core and fundamental part of. We always want to keep the student at the center, and whether we're talking about the SEL approaches, the National Health Education Standards, and what we're doing in the classroom, and actually, all of the other components of the whole school, whole community, whole child model, we want to keep in mind that our goal ultimately is these healthy, safe, supported, challenged, and engaged students. Because when we keep students at the heart of what we do, we're more likely to see change across the lifespan. And while we can't necessarily measure lifespan change in the short time we have with students, what we can do is set them up for a future that allows for this to happen. A couple of things that are going to happen while I go through each of these core competencies of SEL and some relationship to the WSC model is I want you to think about our role as health educators. Primarily, we need to be responsible for helping to make this crosswalk happen. There's a lot of efforts and initiatives going on in schools right now that are specifically focused to SEL, which are fantastic and are benefiting our students. As health educators, we've been involved in SEL since the beginning of health education. When you look at the National Health Education Standards, we're fundamentally embedded in the competencies that are also being worked on through SEL. So we want to be leaders in our school and trusted sources for helping to make this crosswalk and connections and collaborations happen. And that requires us to move beyond our classrooms and beyond our settings to really work as those connectors to make those bridges happen. So let's dive right in. The first CASEL competency is self-awareness. And in the left where the orange is, and you'll notice that the color directly aligns with the model shown back a couple of slides ago. When CASEL defines self-awareness, it's including the emotions that a student may have and having them being able to identify them. Helping students to understand and accurately identify self-perception, recognizing personal strengths, self-confidence, and self-efficacy. One key thing related to self-efficacy is that when we teach health education, and whatever setting we're teaching it in, this is directly related to behavior change. And so we want to, again, make direct connections to helping our students not only learn self-efficacy, right, because we don't teach self-efficacy. What we do is help students to develop their self-efficacy. Some ways that we might do this that bridge across the WSCC model is through skill practice. We need to make sure that we're moving away from health education that's focused on students learning information and knowledge, because we know that's not where behavior change happens. Behavior change happens when we're able to apply our learning in meaningful ways that are relevant to our life circumstances. We want to help to create a climate of health and well-being that extends beyond the classroom or the nurse's office or the cafeteria, but that no matter where students are in the school, they can see and make those connections. Helping students to develop a growth mindset. And again, this is happening in our classrooms, and we may apply it to the work that we're doing and what we're directly teaching. But helping students to recognize that health is not either I have it or I don't, but it's along a spectrum. And when we think about things such as behavior modification and harm reduction strategies, that what this looks like for one student may look different for another student, and that we're moving away from if you don't serve this or if you don't eat this, then therefore you are not healthy. We have to help our students to see that it's about what direction we're facing. And then finally, exploring some ways that emotions can positively or negatively impact our health. When we're having conversations in spaces such as advisory or in homerooms, or we're implementing social competency curricula, how are we helping students to translate that beyond their learning and ultimately think about what that means for their health? From the National Health Education Standards, this competency aligns very closely with the skill of analyzing influences and advocacy. Both of these are places where students need to be self-aware and then to share their awareness with others. If we move into self-management, here we're looking at students being able to have impulse control, strategies for stress management, self-discipline and self-motivation, goal setting and organizational skills. The National Health Education Standards that self-management directly aligns with is the skill of self-management and then also goal setting, because both of these are skills that have to be woven together, and that when we can identify ways to manage ourselves, it then helps us to be able to set goals. So let's look at some connections across WSCC. Using conflict resolution and regulation in physical education. Making sure that when we're talking with our PE teachers, that we're using the same language, because I can guarantee you that your PE teachers are helping to negotiate some of those conflicts that are occurring, especially during gameplay or when students are practicing and learning new skills. Thinking about 10 dimensions of wellness. Now, this may be new. The idea of dimensions of wellness likely isn't, 10 might be. And the two dimensions that are added that I would also include are sexual health and cultural and multicultural health, in addition to the standard 8 that we often employ. Helping students to set goals and work through behavior change in health-promoting ways. Again, similar to the last slide, where we talked about what it means for each student to be able to apply these strategies in ways that work for them. And then finally, designing and implementing strategies for time management. This directly aligns with the skill of self-management, because what we know and what we find with our students today is that they are very much under pressure, right? And that they're trying to manage multiple things in multiple ways for multiple reasons, whether it's that they're looking ahead towards their future or they're trying to manage the day-to-day in ways that they need to in order to be successful. Third, we have social awareness. We define social awareness as students having the ability to take the perspective of those around them. Not only to be able to see what others are saying, but to understand why an individual may think in the way that they do. Now, mind you, this isn't necessarily that they agree with everything that the person is saying. It's that they're better able to understand how and why this might happen. To develop empathy and to employ empathy, both with themselves and with others. And so giving and receiving empathy can be really powerful in helping our students to better understand and take the perspective of others. Appreciating diversity. This goes beyond tolerance, and I would even support that tolerance is a really low level, and we want to help our students to be able to move beyond this and to recognize that diversity helps us all not only to be stronger individuals, to create stronger communities, it also helps us to better serve and to move forward in a health-enhancing way. And then finally, developing respect for others, which ties into some of the other points that I just mentioned. Ways that we can do this across the WSCC model include having students discuss power, privilege, race, identity. What does that mean in terms of health outcomes? In the world of public health, where we don't want to bring politics into it, health is always political, right? Because we come at it from different perspectives. And understanding and helping to have a better sense of why individuals are coming at things from where they are and how they're coming at things. Explore how personal experiences impact food intake, if we're thinking about this from a nutritional perspective, and nutrition services. What access do I have? What food do I have available to me? What choices am I making and why? Moving beyond eat this, not that, but understanding that the foods we have available to us, the proximity in our built environment, play a really large part in the foods that we may select. Resources and materials from local community. This is going out and accessing information, products, and services in health-enhancing ways. When we think about that skill specifically of the National Health Education Standards, oftentimes we default to students accessing information. But here's a great opportunity for them to think about the services that are available to them in their local community. Would they access those services and products? Why would they access those services and products? And if they wouldn't access them, why not? There may be a service that's readily available to students, but they wouldn't use it. And it maybe it's because they're afraid of seeing someone they might know if they go in there. They've had, or someone they know has had a negative experience with that service. Even though it's close in proximity, doesn't necessarily mean that transportation is readily available to them. And so then this leads into that last piece of creating that map of local services and resources. And the beauty of this is that we can do it around any topic area, that we don't need to limit ourselves to one. And in fact, I would encourage folks in their classrooms and when working with students to have them do it for multiple different topic areas. So this is, again, directly related to analyzing influences and advocacy as well, because in order to think about how race and power and privilege and identity have an impact on our health outcomes, we also need to think about that in terms of influences. When we think about relationship skills, the skill that naturally comes to mind for all of this is going to be interpersonal communication, which is multifaceted. This also is going to include social engagement, how we interact with others, the ways in which we interact with others, and I would even include within a health and healthcare setting and environment, the relationships that we build with others. How are we building relationships, and in what ways do those relationships support our health? And finally, teamwork is a key construct of this competency. We want our students to be able to work together in ways that are meaningful and that recognize that different styles and different approaches can work in different settings. So here are some ways that this might translate across a WSC approach. Communicating healthcare needs with a trusted professional. Do we have students practice communicating their asks related to their health? Whether this is in a health education classroom or it's in the nurse's office or with another trusted healthcare provider. We worked with a health educator once when they were in the school and they were doing heights and weights, and they were being pulled out of the health education class. And one of the things that this health educator said was that she really wanted students to ask the healthcare provider, and in this instance, it was a trusted teacher, maybe it was a school nurse, who were taking these heights and weights and measurements. And she said to them, she said, I want you to ask for your information. And in fact, I'm going to ask that the folks don't give you your information unless you ask for it. At first glance, many of the students took a step back and they said, well, it's my information, I deserve to have that. And she said, you 100% absolutely deserve to have that information, and I want you to be an active participant in your health care. And this is one way and one opportunity for you to practice. In my work in higher education with my college students, I often ask them to find a health-related service on campus and how they might use it. And what I find is that every single semester they come back to me, and a large percentage of students have reached out to the counseling and psychological services here on campus. And inevitably, they come back with feedback such as, hey, they're not really scary over there. And as much as I want to chuckle and say they are going to be the least scary people, it can be really intimidating if you've never used a service such as the counseling and psychological services on campus. And so giving students that opportunity to practice that can become really powerful. We want students to advocate, and perhaps they develop an advocacy plan for improved opportunities to be physically active. And this goes beyond advocating to their peers, because we know that students can create, or we often give them opportunities to create posters or infographics for other students. But take it deeper. Look at the root causes of why students may not be getting enough activity. And perhaps it leads into the community. Perhaps it leads into scheduling issues. And encourage our students to advocate to individuals who can affect change beyond the classroom, beyond the school, and into the community and or state setting. To develop their communication skills, whether it be around listening or being an empathetic or empathic communicator and listener. Conflict resolution, understanding the difference between conflict resolution, negotiation, and then how bullying fits into all of that. Unfortunately, we see sometimes that students are asked to mediate out a situation that often is considered a bullying type of situation. And instead, recognizing that those are about power and control, and so not putting our students in a place where they are trying to negotiate out or resolve a conflict that really isn't a space to be resolved in terms of conflict. Building bridges. Again, this could be through the adults. Consider for yourself, when is the last time that the district or school wellness team met and included all of the components, or a vast majority of the components of the WSC model? Oftentimes there might be a leader in the school, and this may be a school nurse, it may be school nutrition, it may be our health or physical educator. However, what we often see, and what I often see in the work that I do, is that these teams are still segmented. And it may or may not include school administrators. It may or may not include students. But the best way to improve communication across different components is to actually bring those folks to the table. Perhaps this may even be in doing something such as a school health index, having students take a look at that, or having them take a look at the wellness policy, and then communicating how they feel that it is impacting them, the school policies. And then finally, resolving conflict and maintaining good sportsmanship. Again, this may show up in a classroom setting, it may show up in athletics, it may show up in the community. Have you created community norms for sportsmanship? And are those norms and opportunities and common agreements utilized in multiple spaces? The last competency that we're going to take a moment to look at is related to responsible decision making. The key here for me with responsible decision making, which directly connects to the skill of decision making in the National Health Education Standards, is that decision making is a process. And our role then as health educators is to help our students see not only that it is a process, but how the process can be put into effect for them, which requires them to be able to identify problems. Not only what problems may be directly impacting them at this moment, but how broader, more societal issues can impact their decision making. Recognizing that health behavior is shaped by more than individual choice, when we help our students to identify problems in a bigger sphere, we can then help them to see what they may have control over and what they may not have control over. We want students to be able to analyze situations, looking into the media. Again, we're pulling in the skill of analyzing influences here, helping our students to be able to recognize when situations are within individual control and when they may be outside of individual control. How do individual choices ultimately start to change the look and shape and feel of a community? What are opportunities to solve problems? Does this involve the work that we do that pulls in family? It may involve the work that we do that crosses over sectors and components of WSC. When we make these decisions, we're evaluating and reflecting on the decisions that were made and how, in turn, those decisions either are leading us in this forward-facing health-promoting direction or are not necessarily helping us to meet the direction or the goals that we have set for ourselves and or for our school and community. And the final piece of this is ethical responsibility. The interesting thing about ethical responsibilities is that as health educators, this idea of ethics it's kind of muddy, right? And that we as humans have different ethics. Our students come from different ethics and beliefs and values, and helping them to critically explore those values, beliefs, and ethics, and in turn, how they affect our decision making. Touching on a few of the other points from the other side here related to the WSC. The second bullet specifically, how does access to services? This is also going to tie back to social awareness. That individual choice may or may not impact and may or may not be available, applicable, or necessary in a situation. We always want students to feel empowered, getting back to this idea of self-efficacy, and develop the agency to be able to make this, but access can absolutely hinder their ability to do so. We want to help students to balance safety concerns with social norms. Oftentimes as health educators, we think about how we help our students to make the most health-enhancing decisions and choices. But what if making the most health-enhancing is actually going to put them into a situation that decreases their safety? Part of the decision-making process, after students look at and work through the process, is to then say, and this is part of the reflection, is would I actually do this? And if I wouldn't actually make this decision, why or why not? And where individual values, beliefs, and social norms come into play, that I may be able to tell you what is right or what you want me to hear, but it may not necessarily be the most health-promoting or health-enhancing for me in that moment. So having looked at all of that, my work here at UNH not only is to prepare health educators, but I take my role as an opportunity to think about how we make these connections and collaborations for our students to go beyond their health education classroom and take it out into the school. When I work with our cooperating teaching partners who are working with our pre-service students, one of the things that I bring to them is this notion that I want our students to recognize that alone in a health education classroom or in a physical education classroom, they're not going to make as much of an impact on students as they could. And when I work with our pre-service students, I help them to see that as health educators, we have an opportunity to go beyond. And I think that oftentimes our pre-service programs are so focused on curriculum development and lesson planning and writing, which our students absolutely 100% need. But we are missing a key opportunity to really dive in and help them to think about how some of these greater issues can affect students and what their role can be in doing that. So some opportunities that I include when I work with pre-service students specifically include in the classroom, so the learning experiences and assignments. One of the resources that I use pretty heavily with my students is the appropriate practices for school-based health education document that comes from Shape America, the Society of Health and Physical Educators. And in this document, I have my students look at not only what the criteria and the categories are, which include looking at the learning environment, curriculum design, instructional practices, assessment, professionalism. It also helps them, and advocacy is the other one. It also helps them to think about what are they doing and how can they do this. So I directly tie the appropriate practices to the work that they're doing. And in fact, our students at UNH have an opportunity for 3 different practicums before they go into their student teaching experience. And so what does that look like? What that looks like is 60 hours in a classroom in an elementary PE setting. They have 60 hours in a secondary, middle or high school, physical education setting, and also 60 hours in a health education classroom at the secondary level. In addition to each of those practicum, which are held in 3 different semesters, students have a seminar that accompanies that. And within the seminar is where I specifically integrate the appropriate practices. And I align that practicum experience with different appropriate practices from that document. And I directly show students the ones that we're working on and we're discussing that week to help them make those connections explicitly for themselves. Other learning experiences that I have during that practicum and student teaching experience from the seminar side is I have them consider cultural competency, race, power, privilege. I have them dig into the tough issues and talk about what it means and what it looks like. When I'm having students coming back, and a specific example from one semester with my student teachers was in 1 week's time, I had one student report they had a student who attempted a suicide in front of them, another student who had a student in their classroom whose mother was hospitalized due to an attempt, and a third student who wasn't present for the attempt, but there was a student athlete who also attempted a suicide. And all of these happened within a 1-week span. And so taking that opportunity to talk about what their role as health educators are and just as school members, right, as part of the school community. And so really helping our students to do that. Another thing that we talk about in these seminars is the CSPAP, the Comprehensive School Physical Activity Model. and really helping our students not to just think about physical education in terms of the classroom, but what are they doing as physical activity experts before, during, and after school, and helping to promote those programs. During the on-site learning experiences, again, weaving more into this, is having our students work with their cooperating teachers around issues such as mandated reporting. When they ask the question about mandated reporting, they're often surprised to find or hear examples from their cooperating teacher of the types of things that they've had to work with and the issues that students bring to the table. I also have students think about and look at wellness policies, to ask their cooperating teachers or to sit in on the district wellness advisory committee, or if there's a school-based committee, to take a look at the wellness policy and to see if they notice any differences or discrepancies in what is going on in terms of school practices, what is happening in the classroom, the coordination or collaboration that's happening, and what's actually in the written policy. I have them explore things such as discipline and the different strategies that are used for discipline. Not only do we ask students to have these conversations with their cooperating teachers, we also have them explore and observe other teachers, to look at how much time is spent in behavior management, how much time is spent in instruction, how much time is spent on skill practice for students versus direct instruction from the teacher from a lecture perspective, right? Time that's all back into the standards, to the appropriate practices, and to the opportunities for how the SEL competencies are integrated across the school building. Inevitably, they come back and say, well, they're doing SEL, or they have a group for SEL, or they've designed these new competencies or standards for SEL, but I'm not seeing them explicitly talked about in the health classroom. And the reason is, and we talk about that they may not necessarily see them explicitly or notice them explicitly is what often the case is. And then once they start digging into the standards, they can then make those connections. But unfortunately, students don't naturally gravitate towards this, so we want to help them to do that. Finally, in the community. So I personally believe that it's really important that when we send our students out into their pre-service settings, that they have an understanding of the community that they're entering into. So having them do their own needs assessment of the community to explore and see what programming is available within the school. What does curriculum look like? What services are available? Do they have a school nurse? Do they have a school-based health clinic? Do they have coordination or collaboration with school food service? Right? Do they have outside community programs that come into the school building? And how are those determined, or how are those decided upon? Does the health and PE teacher have a role in this? I also then have them explore rates of community health issues and community health risk factors that are happening with and among their students, that are happening among the adults. We explore things such as adverse childhood experiences and how to create trauma-sensitive classrooms that recognize that all of our students and each of our students deserves to have that education that is going to help them to lead healthier lives. I also encourage our students to co-present with us, that whether it is through an adaptive physical education conference that we run or at state and national conferences, when possible, we encourage our students to be the voice for what it is we want them to do in the classroom, giving them those opportunities to be presenters. What I found is that it helps them to dig deeper. One of the other things that often happens, and this kind of ties in all three of these, is because our students are being trained here at UNH to look at health education through a skills-based lens that focuses more on skill development with an integration of content as the context for why we do them. What they are then able to do is go into those classrooms and really become kind of a voice for skills-based health education, and in many instances have helped to reshape the way that schools think about the curriculum that they're teaching to their students. So that's just a few of the examples that I have integrated into the work that we're doing here at UNH. I'm noticing over in the questions section that can you describe qualitative and quantitative assessments that you use to gain understanding of the impact from these learning opportunities? A couple of ways that I do that is I look at the assessments that I give students. And so one may be through the, One may be on the outcome measures. So each of our students works with their cooperating teacher to meet certain standards, state-level pre-service standards, in order to become licensed. And so we're gauging how well students are performing on each of those measures. I'm also looking at what they're doing in the classroom. So for example, if I have them do a community needs assessment, how well are they meeting or measuring those criteria? I have them all give presentations, right? So they are then responsible for educating their peers. I do peer feedback based on the identified criteria for those assignments. And then qualitatively, right, we're having conversations. We're having conversations all the time. And we're also doing assessments with and measurement of the pre-service experience with our cooperating teachers. And so gaining feedback from our cooperating teachers, both about preparedness of our students and areas of growth and improvement. This then also comes from the students. We have our students give feedback related to their cooperating experience and whether or not that experience helps them to advance as not only as teachers, but as skills-based health educators. And there have been times that we have found that some experiences are more valuable for students than others, and when necessary, we switch up the sites or we reconsider the learning experiences that we're providing to students. What I'd like to do now is to offer us an opportunity to ask questions. Okay, so the slides also contain the WSC equivalent. So what I didn't do in the slide specifically is identify which component to the WSC and the SEL. I can go through and I can help you to make those connections if that is helpful. But I think the big takeaway for me when I'm doing this work is recognizing that so much of what we do transcends individual components. And that if we really want to make an impact, not only do we have to have collaboration and communication across, we need to recognize that the language we use is really powerful. And oftentimes it's a matter of getting folks on the same page about the language. Then once we do that, it helps our students to see that this is transferable beyond the one domain or dimension that they're working within. I see the question related to how do health educators and government services work with schools? I'm a little bit confused by that question. Jordan, could you provide some clarification?
Sure, and just as a reminder, if you are having any trouble, just locate, if you are in full screen, just exit and you can look at the Q&A function and you can just submit your questions to the group. So how are health educators, so if you are not specifically working in a school or district, maybe how are health educators using the WSC model if they are working in a non-school setting, so maybe in a federal setting promoting the WSC model?
Sure, that's a great question. I think one of the opportunities that we have is to make sure that we're talking with our partners, whether they're after and out of school time partners, their community organizations, their government folks who are working to promote the work that we do, is to have conversations about what actually is happening in the school and what language is being used in the school, because it's going to look a little bit different in each and every community. And so really making sure that we're building up these wellness teams, whether at the district and or school level, in ways that help to be meaningful for the folks in the school, right? So that we're using the same language. So for example, if we're teaching a decision-making model to students, and we're teaching students how to resolve conflict in a certain way, and there's an after-school program, is the same or similar approaches, are students able to see the transfer from the classroom setting to an outside of school setting? Are we bringing in parents into the conversation and helping to engage them in ways that say, here are the ways that we're talking about this in a school setting, and we're really interested in how you can be a part of this and help to shape and craft this language with your students as well. There was a hand raised. Did it go down? I don't see it anymore.
It looks like it.
Okay. Are there other questions? I see the note about the researcher-practitioner partnership for sure, 100%. I think that this is one of those opportunities that we have in working with schools is to better understand the way that students transfer their learning. And if we think about adolescent brain development, that when we learn or when young people learn something in one context, they don't necessarily transfer it to a different context unless prompted to do that. So we want, the more that we can help our students to transfer outside of one context, i.e. the classroom-based setting, or one topic area, and transfer into other areas of their lives, the better off we're going to be in helping them to actually, A, build their self-efficacy, B, improve their health literacy, and C, become healthier human beings. That then where this becomes the research connection is, what does that look like? Because we don't want to make the jump to say, because they learned it in the classroom, that automatically we're going to see these dramatic changes in health behaviors or in risk behaviors. They 100% can have an impact, and that's why we do what we do. But we do need to recognize that the education pieces alone aren't going to make that or solve those issues. Any other questions? This is a great question. So the question is, so WSC and SEL are not synonymous. No, they're actually, they're related but different. So I am going to click back here. Just give me 1 second to locate the slide. Right, so if we look at the WSC model, there it goes. Or I'm sorry, the SEL, this is looking at the competencies that we want students, and I would even argue adults, to develop, right? And related to self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. And then if we shift over to the WSC model is ways in which students and other individuals are able to employ those competencies. So they 100% align with each other, and what we want to help our young people to do, and as the adults, we do it through these different components. And so it may be that our folks who are in the cafeteria and our nutrition services and our folks out in the rest of the school building who are also helping to create a positive nutrition environment, how are we then also helping students to build their relationship skills? Do we have cafeterias that allow for conversation and communication in respectful ways? Or are we looking at things like silent cafeterias, which doesn't provide an opportunity for students to explore and to grow in their communication? If we're thinking about the physical environment, what types of policies and practices are going on in our physical environment that also helps students to manage their impulse control? Right? Employee wellness, I think that we didn't talk about this very much in this webinar, but I think it's important to note, because when we think about the adults in the building, what training and support are we providing to our adults and to our employees to help them model SEL competencies for students? I think sometimes we take for granted that as adults we may know these or we're supposed to know these, but what we know and what we do aren't always aligned. And, I can even speak for myself, is that sometimes I know better but don't always do better. So any opportunity that we can have to help our employees foster relationship skills or to become self-aware about how their actions and efforts are also impacting not only their students, but those around them can be really important. And then providing opportunities for our employees to build in self-care. I think that, again, is also another area that's often overlooked, that when we consider the role of self-care in how we work with students, the better we take care of ourselves, the better then we can help to model for our students the behaviors that we would like to see. Are there any other questions? All right, I'm going to move us back to So one of the questions that came up is that this is being recorded and that the slides will also be shared with that. I am also happy, please feel free to reach out at any time to myself here at the University of New Hampshire. You can also find me on Twitter. I highly recommend folks, if you're not on Twitter, there's a lot of really great stuff happening on Twitter in terms of professional development or sharing what resources folks are using related to school health, related to WSCC, SEL. And to find me on Twitter, I'm just at Alperin, and so pretty easy there to find me. And Health Ed, as Jordan had mentioned, the Twitter chat just happened previous to this, and so you can find all the great conversation that happened during that Twitter chat as well. So Jordan, I'm going to turn it back over to you.
Perfect. So let me switch it over to here. So again, this is not the end of our discussion in social emotional learning and how we can continue to understand how all of these skills and competencies really overlap and can work with promoting health enhancing behaviors, and how it's not teaching SEL at students and with adults, but really looking at how this is really already happening and how it's something that we can work with during the school-based space, and looking how it's already overflowing into your time at home and in the community, and looking at the ways that we can look at these models that exist and find opportunities for overlapping and providing activities for you to bring into your own work. And so we want to continue this conversation. So resources for school health at Sophe, we have WSCC fact sheets that are brand new. So focusing in youth voice, opportunities, and ways for community leadership, both in the school space and in the school's own community, and looking at using an equity framework. We also have SEL resources and tools coming out, as well as training tools in WSCC teams. Some of the things that we discussed here. The school health playlist on YouTube is live. That is another place that you can find this recording, and also, again, going to core if you're interested in continuing education. And the Sophe Health Promotion Practice Special Collection on the Future of School Health Education, the Unifying Framework of the WSCC Model. These are all some really great resources that I'm recommending just as a starter for Sophe. And of course, there are many, many more in the CDC Dash and School Health Branch for the WSCC model as well. If you have any questions based on the conversation that we had today, any of our resources, or continuing the conversation, please visit us on social media, send us an email. Please let us know any thoughts that you have or anything that we did not cover, because we are at our time. So thank you again for everything. Thank you so much for your participation. And we love to hear all of the work that you're doing in school health and all of the various roles that you play.